Today our patient is here for a lower body lift consult and a thigh reduction. So we'll be doing two different educational videos. Talking about the thighs, what you appreciate is that when people come for a thigh lift, a lot of the times they don't really know what they want. They just want their thighs lifted, the sagging skin removed. What you need to appreciate is that skin laxity has directions, right? So you see how when I pull this up, it folds this way, and when I push this way, you have excess this way, okay? So you have vertical laxity, and you have horizontal or circumferential laxity. This is her circumferential laxity. This is how much she has all the way down here, even past the inner knees, she has this. So if you want to remove the inner excess, it's a horizontal correction. This is a width reduction. This is a thigh reduction. Many plastic surgeons and patients call this a vertical thigh lift because of the nature of the vertical incision, but there is no lift here. I actually hate the terminology thigh lift. This procedure should be called a vertical thighplasty or a vertical thigh reduction, or just a thigh reduction, because it's just reducing the width of the thigh. A thigh lift is a thigh elevation, like this. When you want to elevate the thighs, then you have different procedures. You can lift the front of the thighs, you can lift the outer thighs, you can lift the inner thighs, and you can lift the back of the thighs. Sometimes you do all of them, or we do all of them together, so it becomes a circumferential thigh lift, starting, may I rotate you, sweetheart? Starting with an incision that goes underneath the buttock cheek, through which you elevate the back of the thighs. Then that incision goes in the inner thigh, at the junction of the thigh and the groin area, and then that's an inner thigh lift. And then the incision comes up here, and then a front of thigh lift, and then it can go again towards the back over the buttocks, and it becomes the outer thigh lift. So a combination of outer, front, inner, and back can be performed as one to create a circumferential lift. A combination of the back and the inner becomes a spiral thigh lift, which we pioneered in 2007 and 8 and described in plastic surgery textbooks. The thigh front lift is not really described in any textbooks, but I have been doing it for the past 10 years, and it's probably my own method. I don't know if anyone else does it. And then the outer thigh lift is an established method to elevate the thighs, and it's the most powerful thigh lift method, because when it comes to the outer thighs, I can be removing 4, 5, I've done up to 18 inches, believe it or not, from this area. The front of the thighs is only 1 and 2 inches of lift, the inner thighs 1.5 to 2 inches, and then the back of the thighs is only about 1.5 inches. So as you can appreciate, this component of a thigh lift, the outer or the lateral, is the most effective part of a thigh lift. Thank you.